She is going to make testosterone. Her face is going to develop facial hair. Her voice is going to deepen. Her Adam's apple is going to become more prominent. Her chest will broaden. And of course, her testes and penis will enlarge.
All right, so what is going on here? Well, this is a TEDx talk. This is a physician, a female physician, who's going to convince us all that transitioning children is a good idea and that we should all be doing it to all of our children. Now, before we get started, I do want to thank everybody for stopping by and supporting work. Please remember to like, comment, share, and subscribe. You can find me over on Rumble and on Twitter, BitChute, and Odyssey. Now let's dive in here.
7 a.m., the alarm beeps, and 12-year-old Avery gets out of bed. She has to decide between a dress with monkey bar shorts or a glitter top and leggings. Now, shoes, they're always hard. They need to be practical for PE, but also fashionable. She brushes her teeth, combs her hair, puts a headband in place.
Why does a 12-year-old have to be fashionable? Can somebody explain that to me, please?
She grabs her granola bar, lunchbox, and rainbow unicorn backpack and waits for her carpool to pick her up. Right when Avery was handed to her mom sensed a special bond, a mother's intuition, that Avery was different.
Yeah, you can always tell when the child is born, they're different somehow. I mean, typically you look at them and go, wow, what the hell is that? And then you have surgery to repair something that's not supposed to be there. Unfortunately, what this woman's going to say doesn't need to be there is a wiener.
And her parents, as soon as Avery was a preschooler, knew that as a daughter with a penis, they needed to advocate.
Chicks with dicks? Oh my God. Oh my God, I have a disease, all right? I need help. There are no chicks with dicks, Johnny. Only guys with tits.
For her rights, and that they would allow her to live in her affirmed gender. Early on, they sought the help of a child psychologist so that she could live in her affirmed gender.
So tolerant.
There are no affirmed genders. You're making stuff up. You are the gender you're born. That's it, period. If you want to pretend like you're not, that's a different thing.
Currently, only the principal at the school knows that Avery is gender expansive or transgender. And when
Gender expansive, there's a new politically correct term for you.
the signs of puberty started to show, they took her to a gender clinic for kids to start gender affirmation therapy, which is
Yeah, that should be illegal.
the use of medicines and possibly surgery later on to physically align someone with the gender in which they identify.
How does this girl identify? I mean, obviously the parents did this to her, to him, because the mother knew right away when the doctors handed the baby to the mother. Oh, this person is, this isn't a boy. You know what it is? This woman desperately wanted to have a girl so she could dress her up.
I am one of those pediatric endocrinologists or kids hormone doctors that treat children like Avery at Stanford Children's Health.
That's not a thing. You just made that up. So what you're doing is you're a mad doctor. You're a mad scientist. You're performing these procedures on children that don't need it.
And as a kids hormone doctor, I know how to start puberty in someone who's not able to do so on their own.
Really? That's impressive.
I also know how to put puberty on hold if it develops too early. Therefore,
Yeah, that worked out really well for Michael Jackson.
my training puts me in a unique situation to be able to help someone like Avery. And as a girl with a penis,
There are no chicks with dicks, Johnny. Only guys with tits.
Nobody can help Avery, by the way. Nobody but her. She's in the unique position to help her.
she is not going to have the chest development or the body shape that she wants.
How many women out there have the chest development or body shape that they want? I watched, I don't know, this is years ago, something on TLC or Discovery Channel or something. And this fashion photographer, he said that none of these women, not a single one of them is satisfied with their body. Not one. The most beautiful women in the world you can see, on the runway or whatever, on site, on set, doing their posing. Most beautiful women, and they're not satisfied with their bodies.
Instead, she is going to make testosterone.
Heaven forfend that somebody makes testosterone, but women can't make that much testosterone, so don't worry about it.
Her face is going to develop facial hair. Her voice is going to deepen. Her Adam's apple.
Oh, what are you saying, that she's actually a boy? See, could you make up your mind here? See, this indoctrination, these people wholeheartedly believe that this person is a female, even though in the development in the womb, this person developed male.
Apple is going to become more prominent. Her chest will broaden. And of course, her testes and penis will enlarge. Her parents knew that the signs of puberty needed to be put on hold with the pubertal blocker, which is a medication that is used to stop the chemical messages from the brain to the rest of the body that says, hey, it's time to develop. And with the use of a pubertal blocker, I can give Avery another 2 to 3 years so that she can be consistent with the gender in which she identifies.
No, you can't. You can't. I mean, Avery still has a penis and testicles. Just slowing or delaying the onset of puberty does not change that fact.
And if she continues, then estrogen can be added to her therapy so that she could have the development that she would want. However, if she should identify as the gender she was assigned at birth, the pubertal blocker can be stopped and she can have the pre-programmed puberty that she was supposed to have. So in Avery's case...
And there's absolutely no side effects to these drugs at all, right? That's all we hear about now. Is all there's side effects, osteoporosis, cancer, et cetera, et cetera.
She's going to want estrogen. And later on, she can decide if gender affirmation surgery is right for her or not. Gender affirmation surgery is the removal of an ovary, uterus, penis, or testes so that you...
And why would you do that to perfectly healthy tissue?
...could be physically aligned with the gender in which you identify. And right now, gender affirmation surgery is reserved only for those who are 18 years of age or older.
That's a lie. That is an effing lie. What about Chloe Cole? What about Jazz Jennings? And that's just 2. And you know what they say about cockroaches?
Oh, it's a big-ass roach.
If you see one, there's hundreds of thousands of them around somewhere. So there's hundreds and thousands of these children being surgically transitioned.
However, for someone like Avery, would it be more beneficial for her to undergo gender affirmation surgery before the age of 18?
No, it would not. It wouldn't even be beneficial until after 25, because your brain doesn't stop growing until like you're 25 years old. So once your brain settles down, you can make some decisions.
18 is the age of majority, and many states have laws that prevent sterilization or the permanent removal of reproductive capability. However, these laws were made at a time in which transgender adults could not easily get medical or surgical treatment.
You mean at a sane time? I mean, when we were sane? Oh, those times? Okay.
And therefore, these laws were made when people like Avery were not being considered. And as I treat Avery, someone who identified as a preschooler and is getting treatment as an adolescent, is the surgical world ready for the changes that are to come? Currently, I don't think so. But if we start thinking about these changes today, I think we can make a difference. And in fact, as transgender people are more openly being able to seek therapy, the demand for transgender surgery has increased by 5-fold over the past 5 years.
That doesn't seem alarming to anybody? I mean, really, the demand for transgender surgery has increased 5-fold in 5 years. That's a big increase. Short amount of time. Seems kind of fishy to me.
And one may think that the preservation of surgery is a valid one, but in reality is not very relevant or valid. 18 is the age in which minors are protected from making permanent decisions about their reproductive health, because the thought is then at 18 they can decide what they would like to do. However, if as soon as
You know what? When I was 18, I could not have made this decision. There's no way I was mature enough. If I had grown up thinking I'm trans and I want to get this surgery, there was no way I was mature enough at 18 to make that decision.
Pubertal blockers were added, and then estrogen was added to her therapy. Avery's testes never developed. In fact, she does not make any sperm. And her reproductive capability to be a biological parent has been eliminated.
Is that a red flag to anyone else or just me?
Her testes are non-functional. And in medicine, don't we often recommend the removal of non-functional organs, like an appendix?
I don't know about that for sure. I mean, I've never heard of anybody having their appendix removed just because it was non-functional. When it gets inflamed, then they remove it. But you're the one who made the testicles non-functional. You're the one. It's like, I'll burn your house down, and now you don't need house insurance. That doesn't make any sense. Idiots.
So therefore, does it make sense for Avery to wait until she's 18? Or should older adolescents be allowed to have surgery before the age of 18? 18
No.
is also the age of consent. Doctors usually allow those who are 18 to make decisions about their procedures and consent so that you can weigh the risks and benefits. Well then, the transgender patient may be one of the most well-informed patients. Who else has had years of psychological evaluation, months of medical therapy, and has thought of this one procedure for so long?
Well, that used to be the case, but I don't think that's the case any longer. Now you can just go and be like, hey, I feel like I'm trans, and they start giving you puberty blockers. They start socially transitioning you, and you know, within a year, you probably get a surgical transition. So I don't know where you're getting this information from. It used to be a long time. Yeah, you used to have to go through 2 years of minimum of therapy. But that's different now. And even those people who are going through that long period of time of therapy and living like presenting socially as the opposite gender, a lot of them regretted transitioning too. We know this because I've seen the documentaries on people going, hey, I wish I hadn't transitioned.
So rather than to use strict age limits for eligibility, why not use the number of years in which one has lived in their affirmed gender? And insurances and laws should consider older adolescents in getting gender affirmation surgery. Now, these surgeries are not simple surgeries. These are complex surgeries that require very specific pre- and post-operative care. In fact, from the transition of male to female, you need to have up to 6 months of electrolysis before the procedure. And then afterwards, daily exercises so that you can keep the grafted tissue functional. By
Sounds like a good idea to me. Let's all sign up for that.
having an older adolescent have the support of their parents to receive this procedure and afterwards have the best surgical results, we're able to prevent corrective surgeries down the road.
It doesn't sound right to me. You already said that you want to hormonally transition these children before they reach puberty, which makes the reproductive organs stop growing, which means you're going to have less tissue to transition into the opposite sex organs. Sounds like more complications to me.
So why not allow older adolescents before they leave the home to have these procedures and then go out into the world and let them live authentically or off to college and be able to live authentically?
Because that's not their authentic identity. You just think that it is. They just think that it is. It's all psychosis.
Until recently, it was not easy for transgender adolescents to receive pubertal blockers and undergo only one puberty that aligned with who they identified. Previously, they had to undergo the programmed puberty that they were to have, and that caused psychological distress.
Holy crap. Going through puberty causes psychological distress? Alert the presses. This is news to me. It's news to everybody, right? Nobody ever went through puberty and had a psychological distress from it. What the hell? That's what puberty is. It's freaking psychological distress.
Before, we were able to add in cross-sex hormones and then give them the puberty that they would want. So imagine you go through your first puberty and then you get to do it again a second time.
You don't get two puberties. All you're doing is changing their hormonal balance. It's not a new puberty, it's just hormonal balance. And part of the stress of going through puberty is the fact that you don't know what reproduction is a lot of times, right?
Everybody knows that the stork brings the baby.
You don't know what the whole birds and bees are. And then all of a sudden, you start to feel different, start to feel things, and then you get dropped this bombshell of like, oh, this is how we make babies. What? I thought the stork brought them.
But with the opposite sex hormones. Now that is even more distressful. However, one may argue that being able to have your first puberty and have your organs fully mature is the actual advantage, because now sperm and egg could be preserved and you could preserve your biological parenting. However, this does come at a cost. You're now going to need more corrective surgeries, such as facial redefining surgery, shaving of the Adam's apple.
Why do you need those? You don't have to look like the gender that you identify as.
And even top surgery. And all of that is even more distressful. So, for someone like Avery, who's always lived her entire life in the identified gender, puberty is going to out her, and that will also be leading to psychological distress. In fact, we know that transgender youth are 6 times as more likely to have anxiety, depression, and suicide attempt than their non-transgender peers.
Citation needed. And can you prove that this psychological distress is coming from them thinking that they're in the wrong body, or it's just all under the same umbrella of them being psychotic?
And just by giving them treatment with affirmation and parent support, we're able to lower those risks of anxiety, depression, and suicide attempt back to the levels of their non-transgender peers.
Again, citation needed. Where are you getting this information from?
And this work was done by Dr. Christina Olson.
We'll have to look up Christy Nicholson and see how good of a doctor or researcher she is. All right, so I got it right here. I misheard her. She said Christina Olson. I thought she said Christy Nicholson. But we'll look down here. Trans Youth Project. So they only used over 300 subjects So that's a very small sample size when you're talking about a human population. But all right, let's say that their findings are accurate. The conclusion regarding mental health is this. In research examining mental health outcomes, Olson and colleagues have observed typical rates of depression and only marginally elevated rates of anxiety in transgender children when compared to control groups of children. Such findings contrast with reports of poor mental health outcomes among transgender adults. So, it looks like we've been led astray by how this is affecting children. And it's actually only the adults who are suffering from mental health issues to any great degree.
At up to 6 weeks of embryologic development, by prenatal imaging, one cannot tell the difference between a male and female genitalia. Embryologic development follows a very specific pattern, and then the two differentiate into male and female organs. But this initial analogy and similarity in tissue is important, and that is what doctors today use so that from the male genitalia, a vagina can be created. And afterwards, even physicians cannot tell the difference.
Really? I find that hard to believe. Either that or else you're outing yourself as a piss poor physician and saying that this is all bunk. We just made it all up because, look, I mean, we're such bad physicians, we can't even tell the difference between a real vagina and a fake one.
Externally. Now, my surgical colleagues are going to need to come up with new techniques so that they learn how to work with the limited tissue that's going to become available from the adolescents who had been on pubertal blockers and did not have development. They are going to need to think of these surgeries not as reconstructions, but rather as creations. These are not surgeries that are meant to fix or repair someone, but rather life-changing surgeries that are meant to allow the person who's always known who they are to come out and be themselves.
Yeah, they always knew who they were. When I was a child, I wanted to transition. I did. I actually had those thoughts like, I'll get a sex change when I'm an adult. Why? So I would know what it was like to kiss a man with a mustache. Freaking kids are stupid.
Doctors are going to need to be collaborative, compassionate, and also not be competitive in developing these surgeries. And afterwards, we need to have long-term databases that look at not only the quality of life, sexual behavior, and overall health of these children and continue to follow them. Parents often ask me, what will it be like for my child or teen as an adult? Honestly, I don't know. However, I can say, as a provider who affirms gender expansive and transgender youth, the surgical world needs to be prepared for the changes and expectations that are to come from my treatment, commitment, and advocacy. I am willing to take this journey with these families. Are you?
No, I'm not. And the only reason that you're doing it is because you want the money. Guess what? It turns out that if you have a trans patient, you have a patient for life. You persistently need to get treatment throughout your entire life if you go trans. So that's money in the bank. That's it. I mean, the more of them you get, that's money in the bank. So anyway, thanks for watching. This woman is evil. This is a psychotic woke movement and it needs to stop. See you in the next one.